Hi, my name is Sarah Putzer. This is my initial assessment video to include HEENT with cranial nerves plus the neurologic assessment. First, I'm going to do a 360 scan of the room. To include the ceiling, and the floor. Okay. Also, you can visualize my ears. And here we go. Good evening, my name is Sarah. I'm going to be doing a physical assessment of you today to include your HEENT, your cranial nerves, and a neurologic assessment.
Okay.
First, I'm going to start off by cleaning my hands. The patient is well dressed for the weather. His skin is normal for ethnicity. He's clean in appearance. Behavior appears calm. I'm going to start off by inspecting his head to include his hair. There are no dry or dandruff pouches. The hair is distributed evenly. It is thick. No infestations are noted. Next, I'm going to inspect the face for symmetry. The ears and the pinna are symmetrical. Eyes are symmetrical. His nose is midline and mouth. His lips are red and defined. Next, we are going to palpate the head for any lumps, bumps, or tenderness. Okay. And we're going to assess the pinna, auricle, and targus for any pain or discomfort. Next, we are going to assess the frontal sinuses, and I'm going to do that by tapping. Let me know if this is uncomfortable anywhere. Good. And now the maxillary sinuses. Okay. Assessing cranial nerve 5, I'm going to ask you, this is looking at your trigeminal nerve. I'm going to ask you to clench your teeth. Good. And we're assessing the temporal and the masseter muscles. You can relax. Next, looking at cranial nerve 7, I'm going to ask you to smile. Good. Puff out your cheeks. Good. Open your eyes. Raise your eyebrows. Good. Now close your eyes and don't let me open them. Good. That's strong. Okay. Next, we are going to again assess cranial nerve 5, which is the trigeminal nerve. And I'm going to do so by having you tell me where I'm touching you and if it is sharp or dull.
Left cheek, dull. Right head, dull. Right cheek, sharp. Left cheek, sharp.
Okay, good. Now, moving on, we are going to assess the eyes. Here we're looking at the outer eyes. I'm looking at the eyebrows, the eyelashes. I'm going to open the eyes and visualize the lower conjunctiva, the lacrimal ducts, the sclera, the iris, and the pupils. Next, I'm going to assess cranial nerve 2 by having the patient cover one eye, holding the chart 14 inches away. What is the lowest line you can read?
LTFPH.
Okay, good. Now switch eyes, and again.
LTFPH.
Good. So your vision is 20/20. You have perfect vision and you can see at 20 feet away what healthy eyes can see at 20 feet away. Next, I'm going to take a look in your eye by doing an ophthalmoscope exam. Okay, and for the purposes of this, I'm just going to do one side. Typically, you would do this bilaterally. So I am going to take my right eye and look into the patient's right eye, visualizing the red reflex. Following that in to visualize the optic disc, which is sharp. I can visualize the vasculature here. There's an AV ratio of 1:1. The vessels are smooth. There's no nicking. I also am visualizing the macula as well as the fovea centralis. Okay. Next, we are going to continue with the eye exam. I'm going to look here at cranial nerves 3, 4, and 6 by assessing the pupillary reaction to light as well as the extraocular eye movements. So the first thing I'm going to do is take a pen light and I'm going to have you open your eyes. I'm going to look directly at your eyes with the pen light. Good, and I see your pupils constrict. Good. Okay, now I am going to look at both of your pupils. Good. And now we're checking for accommodation. Good. Okay. Next, if you'll follow my fingers. Good. Eye movements are equal with no nystagmus noted. Okay, next moving on to the nose. We're going to inspect the nose. It is midline. It is symmetrical. Both nares are patent. I am going to do an exam visualizing the nasal mucosa, which is pink and moist. Also here I'm visualizing the septum, which is midline, as well as the turbinate. Okay, now assessing cranial nerve 1, I'm going to have you close your eyes, obstruct one of your nostrils, and I'm going to tell me what you smell.
Fingernail polish remover.
Try again.
Rubbing alcohol.
Okay, good. Okay, next we're moving on to the ears. This is cranial nerve 8, where we're going to assess hearing. I'm going to conduct a whisper test. Repeat what I whisper in your ear.
War eagle.
Okay, good. For my Georgia Bulldog, that's huge. Thank you. Next, we're going to do the Weber test to assess lateralization of sound. I'm going to place this tuning fork on top of your head. I want you to let me know if you can hear it in both ears or just one.
Both.
Good. Next, we are going to assess the Rene test. I'm going to tap the tuning fork, place it on your mastoid bone. Once you stop hearing it, let me know. I'm going to place it directly in front of your ear, and if you could let me know again when the vibration stops.
Stop. Stop.
Good. Okay, so air conduction here is demonstrated greater than bone conduction. Again, this is an exam we would do bilaterally, but for the purposes of time, we're just sticking with one side. Next, I'm going to look inside your ear. Okay. Pulling up and back on the pinea. Let me come over here so you can see my technique. Up and back on the pinea. I'm visualizing the canal. There's no redness noted. Small amount of yellow colored cerumen. The tympanic membrane is visualized by its pearly gray appearance with a cone light reflex at approximately 5 o'clock. I am able to visualize the malleus, the long and short processes, as well as the umbo. There is no bulging of the tympanic membrane and no fluid is noted. Okay, next we are going to look inside the mouth. I'm going to visualize the buccal mucosa, which is moist and pink, The dentition is normal throughout the mouth. There's no caries noted. I am looking at the gingiva, which is good. I'm visualizing the tongue. I'm gonna have you stick your tongue out, assessing cranial nerve 12, the hypoglossal nerve. I'm gonna ask you to move your tongue back and forth. Good. Now open wide, visualizing the oropharynx. I can visualize the uvula. There are no tonsils present, and I am visualizing the floor of the mouth as well. Okay, at this point, I'm going to take a tongue depressor to assess movement of the uvula, which is cranial nerve 9, the glossopharyngeal, and the uvula rises. At this point here, we could assess cranial nerve 10, which is the gag reflex, but we won't do that to our patient. Okay. Moving on, I'm going to go ahead and assess the neck. I'm going to start off by palpating here, assessing for the trachea, which is midline. There's no crepitus, no difficulty with breathing. At this point, I am going to go ahead and assess all of the lymph nodes, looking at the pre-auricle, the post-auricle, the occipital, the peritonsillar, submandibular, submental, the anterior chain, the posterior chain, the supra, and the infraclavicular. There's no tenderness, there's no swelling noted here. Next, I'm going to have you turn towards the camera, and I am going to come from behind you to assess your thyroid gland. If you could, you'll feel a little bit of pressure. Please swallow. Good. And again. Good. Okay, there's no nodules or goiter noted here. Also, while examining the neck, I'm going to assess for a carotid pulse, which is strong and normal in rhythm. Again, strong and normal in rhythm. At this point, I'm going to go ahead and auscultate the carotids. If you would, take a deep breath in and hold it. Good, and let it out. Good. Again, deep breath in and hold it and let it out. Good. The blood flow sounds normal. There's no bruise. Okay, moving on to cranial nerve 11, the accessory nerve. I'm going to ask you to shrug your shoulders. Good. Now I'd like you to move your head into my hand. Good. And again, this side. Okay. Can you move your head down and back? Good. Okay. That concludes the HEENT with the cranial nerves. Now we're going to move on to the neuro exam. Again, this patient's appearance is appropriate, behavior is appropriate this far. We're going to assess the cognition. Can you state your name and date of birth, please?
Nick, February 10th.
Okay. Can you tell me what year it is?
2023.
Good. Now we are going to assess your recent and remote memory. What did you do yesterday?
Flew on a plane.
Okay, I'm going to give you a word to remember and I'll ask you later in the exam. Apple. Okay, next, moving on, we are going to assess your reflexes. So first I'm going to take my reflex hammer and I am going to ask you to let me position your arm. Again, for purposes of this video, we'll do one side, but I am going to assess the bicep reflex. Good, small movement of the hand there. Now we're going to assess the tricep reflex. Again, we see movement. The brachioradialis. Good, small twitching of the hand there. Now the patellar reflex. Good, small twitching. The Achilles. Good, and the Babinski. Good, no toe fanning. Next, I'm I'm going to assess your stereogenesis. I'm going to place an object with your eyes closed in your hand, and I want you to tell me what this is.
Paperclip.
Good. Now I'm going to assess graphesthesia. I'm going to draw something in your hand if you'll let me know what this is.
Figure 8.
Good. Assessing your neurosensory, I'm going to touch you with either a sharp or dull object. Just let me know where I'm touching you and if it's sharp or dull.
Sharp. Dull.
Good.
Sharp. Dull.
Okay, where am I touching you?
I'm sorry, arms.
Good. Okay, look at your legs.
Left leg, dull.
Good.
Right leg, sharp.
Good. Okay, next we're going to assess your coordination. I'm going to ask you to do rapid motions, flipping your hands forward and backwards. You can open your eyes. Good. Next we're going to do the finger to nose test. So I'd like you to put your finger on your nose and to my fingers. Good. Nose, fingers, nose, fingers. Good. Okay. Next I'm going to ask you to do a heel to shin test. So take, good, coming back, good. Okay, and I have you stand up. We're assessing your balance with your eyes closed. Good, there's no sway. With your eyes open, good. Now I'm going to ask you to hop on one foot. Good, okay. Now facing the camera, I'm going to assess your gait. If you'll walk towards the video, you can open your eyes and stop, turn around, and if you'll walk heel to toe tandem, good, and turn around again and walk towards the camera if you'll walk on your tiptoes. Good. Okay, you can come back and have a seat. Now, what was that word I mentioned to you?
Apple.
Good. This concludes the portion of our neurologic exam. I would like to go back to the eye exam and demonstrate confrontation by asking him to open his eyes. I'm going to assess your peripheral vision, and I would like you to tell me when you see my fingers and how many I'm holding up. If you'll cover one eye. Thank you. Again, this would be done bilaterally, but for purpose of this, unilaterally.
I see them. 2. 1, 2, 3.
Okay, good. Thank you. This includes the assessment.